You're at home, maybe relaxing, and then a wave of worry hits you. Your small animal, your pet, has a concerning wound, or maybe a swelling that looks like an abscess, or you even suspect a burn. Your
Hmm.
mind just starts racing, right?
Yeah,
Why do we?
exactly. It's that moment of panic.
So this deep dive, it's really designed to cut through some of that panic. I want
Right.
to equip you with some essential knowledge about veterinary triage, specifically for these kinds of dermatological emergencies in your pets.
Think of it as getting the crucial insights quickly so you can act with a bit more confidence.
Right. And what's interesting is we looked into this, is that whether it's a cut or that pocket of infection, an abscess, or even damage from heat or chemicals,
Hmm.
those first critical steps often share a common thread, don't they?
They really do. We've looked at some pretty detailed veterinary protocols, covering things like extensive wounds, abscesses, and also those really aggressive skin infections like necrotizing fasciitis.
Which some people call flesh-eating disease, right?
Yeah.
Sounds terrifying.
Yep. It is very serious. And also severe pyoderma, which is basically a deep skin infection, plus, of course, thermal and chemical burns.
So our goal here is really to kind of pull out the vital pieces of information from these protocols.
Yeah, to give you a clear, actionable understanding of what those really crucial first moments involve.
Exactly. Think of this as our roadmap for today. We'll start by navigating that rapid initial assessment, like what are the absolute must-know signs you should look for?
Then stabilization, those immediate actions that you might need to think about, things that can really influence the outcome.
Definitely. We'll also touch on the diagnostics your vet might use to really pinpoint the problem.
And finally, the basic principles guiding treatment for each type of situation.
And through it all, remember, the driving force is always, always the well-being of your animal.
Absolutely. So should we dive into extensive wounds and abscesses first?
Let's do it. So, you spot a wound. What's the first thought process?
Okay, first step is a quick but thorough visual check. Where is it on the body? Roughly how big is it? Does it look superficial or deep?
Is it bleeding?
Crucially, yes. Is there active bleeding? Can you see underlying tissue, something that, shouldn't be exposed?
Okay. And for an abscess, what are the telltale signs there?
With an abscess, you're typically looking for a localized swelling. It might feel soft or maybe even fluctuant, kind of like a water balloon under the skin.
Okay.
And really importantly, look for overall signs that your pet just isn't well, like a fever, maybe they're unusually tired, lethargic, or perhaps off their food.
Right, those systemic signs. And those immediate stabilization steps. What are the absolute critical actions someone should take or at least be aware of?
Well, for a bleeding wound, the number one thing is direct pressure. Use a clean cloth, apply firm, steady pressure right on the wound.
Simple but effective. What if it's bleeding a lot?
If it's significant bleeding or it just doesn't stop easily, veterinary protocols do mention things like hemostatic agents or more complex bandaging. But that's really something your vet will handle once you get there. Direct pressure is your main job initially.
Got it. And pain. These things must hurt.
Oh, definitely. Pain is a major factor. And it's helpful for owners to know that vets will often use opioid pain relievers, things like buprenorphine or methadone, quite early on. It makes a huge difference to the animal's comfort and stress levels.
That's good to know. What about fluids? You hear about shock sometimes with injuries.
Yes, fluid therapy is critical, especially if the pet might have lost a lot of fluid, maybe through bleeding, or if they're showing signs of shock like being weak, pale gums, rapid heart rate.
So what do they use?
Usually isotonic crystalloid fluids, things like lactated ringer solution or standard 0.9% saline. Giving these fluids, often quickly, is what's called a bolus.
Like a larger amount fairly fast.
Exactly. It helps restore blood volume and circulation, getting oxygen to those vital organs. It can be genuinely life-saving in shock situations.
So, okay, beyond stopping the bleeding and thinking about shock, what else should someone do right away with a wound?
Preventing more contamination is really key. So gently covering the wound with a sterile dressing is ideal. If you have sterile saline, moistening the dressing slightly can be good.
Just to protect it.
Yeah, protect it from dirt, hair, further bacteria until you can get professional help. And also, try to keep an eye on your pet's vital signs, their heart rate, breathing effort, maybe their gum color, their temperature, if you can safely take it.
That information could be useful for the vet.
Absolutely. And if they seem to be struggling to breathe, perhaps from pain or shock, just letting the vet know immediately is important. They might need oxygen therapy.
Okay, so you've done that initial first aid, you've rushed your pet to the vet. What diagnostics are they likely to start with to figure out exactly what's going on?
Well, the physical exam is still paramount. The vet will carefully look at the wound or abscess, check its characteristics, feel the surrounding tissues for swelling or pain, and assess the animal overall.
But they'll need more info than just looking, I assume.
Oh, for sure. Blood work gives a much deeper picture. A CBC, a complete blood count, is standard. It helps look for signs of infection. Often you'll see an increase in white blood cells.
Or sometimes a decrease, right? In really bad cases.
Yes, exactly. In severe infections, sometimes leading to sepsis, the white cell count can actually drop, which is a worrying sign. A serum chemistry panel is also vital.
What does that show?
It checks things like kidney and liver function, blood sugar, protein levels, electrolytes, basically assessing organ health and hydration. And if there's been significant bleeding, they might run a coagulation profile to check the blood's clotting ability.
Makes sense. What about imaging, like x-rays?
Yeah, imaging plays a big role too. Radiographs or x-rays are great for finding things like foreign objects, maybe a piece of glass or wood stuck in a wound.
Or if a bone is broken nearby.
Precisely, especially with trauma. Ultrasound is another really useful tool. It uses sound waves, so it's excellent for looking at soft tissues. You can visualize fluid pockets, like in an abscess, really clearly.
See how deep it goes.
Yes, and assess the surrounding tissue health. And especially when infection is suspected, we rely heavily on cytology and culture.
Okay, explain those a bit.
Cytology is basically taking a small sample, maybe with a swab or a fine needle, and looking at the cells under a microscope right away. It can give a quick idea if there are bacteria, what type of inflammatory cells are present.
Like a preliminary look.
Exactly. Then, bacterial culture and sensitivity testing involves sending a sample to the lab to grow the specific bacteria causing the infection.
And sensitivity.
That tells us which antibiotics will actually kill those specific bacteria. It's crucial for choosing the right treatment, especially with resistant infections becoming more common.
Okay, that makes a lot of sense.
Yeah.
So the vet has done the exam, the tests, they have a diagnosis. What does the actual treatment plan look like for, say, a significant wound?
For wounds, the first big steps are cleaning and debridement. They'll flush the wound thoroughly, usually with sterile saline or sometimes a very dilute antiseptic like chlorhexidine. You want to avoid things like hydrogen peroxide or alcohol, which can actually damage tissue.
Right, and debridement. That sounds surgical.
It often is. Debridement means removing any dead, damaged, or heavily contaminated tissue. This tissue can basically act as a breeding ground for bacteria and stops the wound from healing properly. It might be done surgically with scalpels and scissors, usually under sedation or anesthesia.
Are there other ways?
Sometimes, yeah. Mechanical debridement using special types of bandages can work for certain wounds. Then comes the question of how to close the wound.
You mentioned different ways earlier.
Right. It depends on the wound's age and cleanliness. If it's a fresh, clean cut, less than maybe 6 to 8 hours old, they might close it directly with sutures. That's primary closure.
What if it's older or dirtier?
Then they might wait a bit. Delayed primary closure means they'll manage it as an open wound for maybe 48, 72 hours, let it start cleaning up, ensure no infection is brewing, and then suture it.
And sometimes they don't suture it at all.
Correct. For large wounds with a lot of tissue loss or heavily contaminated ones, they might opt for second intention healing. That means the wound heals gradually from the inside out, filling in with granulation tissue. It takes longer, but sometimes it's the best option.
Okay. What about drains? They sometimes look a bit scary.
Drains can look alarming, yeah, but they're incredibly useful. If there's dead space under the skin or significant fluid drainage expected, a vet might place a drain, like a soft rubber Penrose drain or a suction-based Jackson-Pratt drain.
What's the point?
It allows inflammatory fluid, exudate, and any remaining debris to escape instead of collecting under the skin. Fluid collections, called seromas or hematomas, can delay healing and become a focus for infection.
Got it. And bandages?
Bandaging is usually crucial after wound surgery or cleaning. Vets typically use a 3-layer approach. There's a primary layer right against the wound, ideally nonstick.
Like Pelva?
Exactly, or sometimes special medicated or moisture-retentive dressings. Then an absorbent secondary layer to soak up drainage, provide padding, and finally a tertiary layer, often elastic wrap, to hold it all together and provide some support.
Okay, and what about abscesses? How is that treatment different?
Abscess treatment is generally focused on incision and drainage. Under sedation or anesthesia, the vet makes an incision into the abscess pocket to let the pus drain out.
Just let it drain.
While they drain it thoroughly, then flush the cavity repeatedly, again, usually with sterile saline or dilute antiseptic. They'll also debride any obviously dead or unhealthy tissue lining the abscess cavity. Sometimes a drain is placed here too for a few days.
And antibiotics are key here too, I imagine.
Absolutely essential for abscesses. Vets often start with what we call empirical antibiotics, a best guess based on likely bacteria while waiting for culture results.
Like what?
Clindamycin is a common choice because it's good against anaerobic bacteria, which are often found in abscesses, especially from bite wounds, or something like amoxicillin clavulinate, which covers a broader spectrum of common skin bacteria.
Right. And it's not just treating the wound or the abscess itself, is it? There's the whole animal to consider.
You're absolutely right. Systemic support is critical. This often includes systemic antibiotics, maybe broader spectrum ones given intravenously at first, especially if the infection seems severe or is spreading.
What about pain and inflammation control beyond the initial opioids?
Yes, once the animal is stable, particularly their hydration and kidney function, vets often use non-steroidal anti-inflammatory drugs, NSAIDs like carprofen or meloxicam. They help manage pain and reduce inflammation, which aids healing.
Yeah, nutrition. Does that play a role?
A huge role. Healing requires a lot of energy and protein building blocks, so ensuring good nutrition is vital. A high-protein diet is usually recommended.
What if they won't eat because of pain or feeling sick?
That's a common problem. In those cases, assisted feeding might be necessary. Sometimes simply syringe feeding palatable, high-calorie food works, but if not, placing a temporary feeding tube might be the best way to ensure they get the nutrition they need to heal.
Okay, so treatment has started. How closely does the vet team watch the animal's progress?
Monitoring needs to be really close, especially initially. The veterinary team will reevaluate the wound or abscess site at least daily, sometimes more often. They'll check the dressings, look for signs of healthy healing or potential infection.
Checking vital signs, too.
Definitely. Heart rate, respiratory rate, temperature, pain levels, all monitored regularly. Repeat blood work might be needed to track the response to antibiotics, check organ function, make sure things are moving in the right direction.
And then eventually the pet goes home. Communication with the owner must be key then.
Oh, absolutely critical. Clear, thorough discharge instructions are essential. You, the owner, need to understand the injury, the treatment performed, how to give all the medications correctly, timing, dose, route.
How to care for the wound or drain, if there is one.
Exactly. What to look for in terms of complications, like increased redness, swelling, or discharge. Activity restriction is usually vital, too.
The dreaded cone.
Often, yes. The Elizabethan collar, or E-collar, is usually necessary to prevent licking or chewing at the wound, which can cause major setbacks. And finally, a clear plan for follow-up appointments is crucial.
Makes sense. So, what's the typical outlook, the prognosis for these kinds of wounds and abscesses?
Generally, for well-managed wounds, even quite extensive ones, the prognosis is usually good. Healing might take time and effort, but it's often achievable. For abscesses, if treated promptly and properly, the prognosis is typically excellent.
Any caveats?
Well, with abscesses, especially those from fight wounds, recurrence is possible if the underlying cause isn't fully resolved or if there are underlying health issues. But overall, quite positive outcomes.
Okay, that's reassuring for those situations. But let's move on to some of the more serious-sounding dermatological emergencies. Necrotizing fasciitis and severe pyoderma, these sound particularly scary.
They are indeed very serious conditions, and recognizing them early is key. With necrotizing fasciitis, that rapid initial assessment is absolutely critical. You're looking for signs like a rapidly spreading area of tissue damage, necrosis.
Like the tissue is dying.
Exactly. Often accompanied by severe pain that seems way out of proportion to how the skin might look initially. Fever is common, and systemic signs of sepsis like a very high heart rate, low blood pressure, lethargy.
What might you actually see or feel on the skin?
You might see significant swelling. The skin can become discolored, maybe purplish or blackish. Sometimes you can feel crepitus.
What's that?
It's a crackling or popping sensation under the skin like Rice Krispies. It's caused by gas produced by certain types of bacteria, and there might be a foul-smelling, often watery or bloody discharge. It's a true surgical emergency.
Wow. Okay, and severe pyoderma, how does it present?
Severe pyoderma is essentially a very widespread, deep bacterial skin infection. You'll see extensive areas with pustules, those little pus-filled bumps, lots of crusting, hair loss, redness. Often there's a really unpleasant odor.
Is it usually just the skin, or can it affect them systemically too?
While it's primarily a skin issue, really severe, deep pyoderma can sometimes make the animal feel systemically unwell, maybe lethargic, or have a fever. especially if underlying conditions are present.
So for these really critical conditions, when it comes to immediate stabilization, are the basic principles the same as for, say, a large wound?
Yes, the foundations are very much the same, but often needed more urgently and aggressively. Effective pain management, usually with potent opioids like methadone, is paramount right away.
Fluids, too.
Absolutely. Aggressive fluid resuscitation with isotonic crystalloids is vital, especially if there are signs of dehydration or, more likely with NF, septic shock. Getting that circulation supported is job number one.
Oxygen.
Often necessary, yes, especially if they're showing signs of sepsis or respiratory distress, low blood oxygen levels. And with necrotizing fasciitis specifically, it's really important to handle the affected tissues very gently.
Why that?
Excessive manipulation or pressure could potentially worsen the spread of the infection along the fascial planes, the layers under the skin. So, gentle handling, maybe applying sterile saline-soaked gauze to cover the area, is advised.
Okay. How do vets diagnose these more aggressive infections? What tests are crucial?
Again, blood work is key. CBC can show dramatic changes in white cells very high or sometimes dangerously low in sepsis. Anemia, low platelets might also be seen. Serum chemistry helps assess organ function, electrolytes, albumin levels, which can drop significantly.
What about looking directly at the skin infection?
Skin cytology is very important. Doing impression smears from affected areas or fine needle aspirates allows for rapid microscopic checks for bacteria, inflammatory cells, maybe even helps differentiate NF from other things. And bacterial culture and sensitivity are non-negotiable here. You need to know exactly what you're fighting and what will kill it.
Imaging. Does that help?
It can. Ultrasound might show fluid pockets or gas tracking through the tissues, which strongly suggests NF. Radiographs can sometimes show gas, too. If available, CT or MRI can give much more detailed views of how deep the infection goes in suspected NF cases, but often surgery can't wait for that.
Right. Any other tests?
For cases that aren't responding as expected or look unusual, testing for fungal infections or other atypical bugs might be needed. And if sepsis is strongly suspected, drawing blood cultures to try and isolate bacteria from the bloodstream itself is important.
The treatment for something like necrotizing fasciitis, I imagine it has to be incredibly aggressive.
You're absolutely right. It's a race against time. Rapid and aggressive surgical debridement is the cornerstone. All the dead, necrotic, infected tissue must be removed surgically. This often requires multiple surgeries.
And washing the area.
Yes, extensive lavage, washing out the wound beds, is critical during surgery. Alongside surgery, immediate administration of broad-spectrum IV antibiotics is vital. Often a combination targeting aerobic, anaerobic, gram-positive, and gram-negative bacteria is started right away.
And then adjusted based on culture results.
Exactly. Plus, intensive supportive care is essential. Continuous rate infusion, pain medication, ongoing IV fluids, nutritional support. Sometimes they need feeding tubes or even IV nutrition, and very careful wound management post-op. Things like vacuum-assisted closure or VAC therapy can be really helpful here.
That sounds incredibly intensive. What about severe pyoderma? Is the treatment approach similar?
While it still needs diligent management, it's usually less acutely life-threatening and less surgically focused than NF. Topical therapy plays a really big role. Medicated shampoos, usually containing chlorhexidine or maybe benzoyl peroxide, are used frequently to reduce the bacterial load on the skin surface.
Creams and things, too.
Yes, topical antibiotic creams or ointments like mupirocin might be used on focal lesions. But systemic antibiotics are almost always necessary for severe, deep pyoderma.
Which ones?
The choice depends on severity, culture results, if available, and previous history. Oral antibiotics like cephalexin or clindamycin might work for less severe cases, but deeper or resistant infections often require stronger options like fluoroquinolones or maybe combination therapy based on sensitivity testing. Treatment usually needs to be long-term, several weeks at least.
Do steroids ever play a role, like prednisone?
Very cautiously, and usually only much later if an underlying immune-mediated issue is suspected and the infection is well under control. Steroids suppress the immune system, which is generally the last thing you want with a bad infection, so it's not common and needs careful consideration.
And finding the underlying cause seems important for pyoderma.
Absolutely crucial for long-term control. Pyoderma is often secondary to something else. Allergies are very common, like environmental or food allergies. Endocrine diseases like hypothyroidism or Cushing's disease can also predispose animals. Managing that underlying trigger is key to preventing recurrence.
Okay. And monitoring for these serious conditions just as critical as the initial treatment, I guess.
Even more so, perhaps. Continuous close monitoring is essential. For NF patients, that means intensive care unit level monitoring often. For severe pyoderma, frequent rechecks are needed.
What are they looking for?
Assessing the wounds or skin daily, watching vital signs, repeating blood work to track infection markers and organ function, constantly assessing pain levels, and monitoring the response to antibiotics. Are things getting better, worse, staying the same? Adjustments to the plan are often needed.
And again, that communication with the owner when they eventually go home.
Critically important. For NF survivors, the recovery is long and requires huge owner commitment. For severe pyoderma, owners need to understand the chronicity, the need for long-term medications, possibly special bathing routines, detailed instructions on wound care if needed, meds, recognizing flare-ups, and the importance of rechecks cannot be overstressed. E-collars are usually essential here too.
What's the general outlook, the prognosis for these two?
Well, for necrotizing fasciitis, the prognosis is unfortunately often guarded to poor. Early and aggressive surgery is truly the main factor that improves chances, but it's still a very dangerous condition.
And severe pyoderma.
Severe pyoderma typically has a better prognosis in terms of survival, usually good with appropriate, consistent treatment. However, the big challenge is recurrence. Relapses are common, especially if those underlying causes aren't identified and managed effectively. It can be a frustrating condition to manage long term.
Okay, quite a contrast there. Finally, let's tackle burns, both thermal from heat and chemical burns. These can be really awful injuries.
They absolutely can be, and very frightening for owners to witness and deal with. The initial rapid assessment is really about two things: estimating the extent of the burn, the total body surface area or TBSA involved.
How do they measure that?
Vets use charts or rules, like the rule of nines adapted for animals, to estimate the percentage. Burns are often categorized as minor, maybe less than 10-15% TBSA, moderate or severe, often over 20-25% TBSA. The other key factor is depth.
Like how deep it goes into the skin.
Exactly. Superficial burns, like a mild sunburn, just affect the top layer. They're red, painful, but usually heal well. Partial thickness burns go deeper, causing blistering and more significant pain. Full thickness burns destroy all layers of the skin, may look charred, leathery, or white, and sometimes aren't painful initially because the nerve endings are destroyed.
Location matters too, right?
Definitely. Burns on the face, especially near the airway, paws, or the perineal area, are considered more critical due to potential complications like breathing issues or difficulty with urination defecation and higher infection risk.
So what are the absolute first aid, immediate stabilization steps for a burn?
First things first, especially with house fires or chemical exposure, check the ABC's airway, breathing, circulation. Is there evidence of smoke inhalation? Any chemical residue around the mouth or nose?
Okay, ABC's first. Then what for the burn itself?
For thermal burns, heat burns, the immediate goal is to cool the tissue gently to stop the burning process. Apply cool, not ice cold, water or saline to the area for about 10 to 15 minutes. Soaking towels in cool water and applying them works. Avoid ice, as it can cause more damage.
And chemical burns. Different approach.
Yes. The absolute priority is decontamination. Flush the affected area with huge amounts of clean, running water or saline for a prolonged period, at least 15 to 30 minutes, is often recommended. This is to physically wash the chemical off the skin.
And protect yourself while doing it.
Crucial. Wear gloves. You don't want to get the chemical on yourself. Pain management is vital early on, usually starting with opioids like buprenorphine or methadone.
What about NSAIDs, like for wounds?
Generally avoided initially with burns, especially severe ones. Burns can cause fluid shifts and potentially affect kidney function, and NSAIDs can sometimes exacerbate kidney issues, so vets are usually cautious with them at first.
Fluids are probably critical here too.
Extremely critical, especially for moderate to severe burns. Animals lose a massive amount of fluid through burned skin. Aggressive intravenous fluid resuscitation with isotonic crystalloids like lactated ringers is essential to prevent shock and support organ function.
Is there a specific way they calculate how much fluid?
Yes, often they use something called the Parkland formula. It's a calculation based on the animal's body weight and the estimated percentage of TBSA burned. It helps guide the fluid rate, typically giving half the calculated volume in the first 8 hours and the rest over the next 16. And providing a quiet, warm environment is also important to minimize stress and prevent heat loss, as burn animals lose body heat easily.
Okay. What diagnostic tests are common for burn patients once they get to the vet?
Blood tests are really important. A CBC to check for inflammation, infection later on, or anemia. Serum chemistry is vital to monitor electrolytes. Potassium can get dangerously high with severe burns kidney function, protein levels, as they lose a lot of protein through the wounds. Blood gas analysis checks for metabolic problems like acidosis or low oxygen levels from potential inhalation injury.
Coagulation tests.
Yes, a coagulation panel might be run for severe burns as clotting abnormalities can occur. Urinalysis is also useful to check for pigments like myoglobin or hemoglobin, which can indicate muscle damage or red blood cell breakdown and can harm the kidneys.
Any imaging needed.
Chest x-rays, thoracic radiographs are really important if there's any suspicion of smoke inhalation, to look for damage to the lungs or aspiration pneumonia. Abdominal ultrasound might be considered if there's concern about internal injury, though less common just for skin burns.
Got it. And the treatment plan for the burns themselves, what does that involve?
Burn wound care is delicate. It involves very gentle cleaning, usually with sterile saline or maybe dilute chlorhexidine. Aggressive scrubbing is avoided as it can damage fragile healing tissue.
Debridement needed here, too.
Yes, removal of dead tissue, debridement, is often necessary, especially for full-thickness burns. This might be done surgically once the patient is more stable. Then dressings are applied.
What kind of dressings?
Usually non-adherent sterile dressings are preferred initially, like Telfa pads or special hydrogel dressings that provide moisture. A common topical treatment is silver sulfadiazine cream, SSD, which has antimicrobial properties to help prevent infection. Dressings usually need to be changed frequently, often daily, especially early on.
Systemic treatments, like antibiotics.
Systemic antibiotics are often used prophylactically, meaning to prevent infection, as burn wounds are highly susceptible. Something broad spectrum might be started. Pain management continues, often with opioids initially, perhaps transitioning to NSAIDs like meloxicam later if kidney function is stable.
Anything else?
Continued full fluid therapy is crucial, adjusting based on hydration and ongoing losses from the wounds. Some vets might use antioxidants like vitamin E. Anti-nausea medication like meropitant might be needed if they feel sick, and nutritional support is massively important.
Why so important for burns?
Burn injuries create a huge metabolic demand. The body needs vast amounts of calories and protein to heal, so a high-protein, high-calorie diet is essential. If they aren't eating enough on their own, assisted feeding via syringe or feeding tube is absolutely necessary for recovery.
And just like the other emergencies, ongoing monitoring must be intense.
Incredibly intense for significant burns, frequent checks of vital signs, daily monitoring of electrolytes, kidney values, protein levels via blood work is common. Careful daily assessment of the burn wounds for healing progress or signs of infection, which is a major risk. Monitoring urine output is also key to assess hydration and kidney function.
And owner communication for discharge.
Absolutely. Owners need to understand the severity, the likely long and intensive recovery period. Detailed instructions on wound care, which can be complex and time-consuming medication administration, recognizing signs of infection or other complications like scarring or contractures, which can restrict movement later. Strict activity restriction and follow-up schedules are vital.
What's the prognosis typically like for burns?
It really depends on the extent and depth. For superficial or small partial thickness burns, the prognosis is generally good with proper care. However, for extensive full thickness burns, especially those covering more than, say, 20-25% TBSA, or those complicated by severe infection or inhalation injury, the prognosis becomes much more guarded. It can be a long, tough road.
Wow. This has been an incredibly thorough look at how vets approach these really challenging skin emergencies. Having this kind of framework, just understanding the initial response, feels really valuable.
It really is. I mean, understanding these basic triage protocols, it gives you a framework, right, for how to respond effectively in those first, often really stressful moments.
Yeah, it's not about making you the vet.
Not at all. This information is definitely not a substitute for getting immediate professional veterinary care. But just being familiar with these principles might help you stay a little calmer, maybe provide better information to the vet team when you call or arrive.
And that could potentially make a critical difference in the outcome for your pet.
Exactly. And it's so important to remember, while we've covered a lot, every single situation is unique. Every animal is different.
Prompt veterinary attention, getting that accurate diagnosis, and a tailored treatment plan for your specific pet. That's always, always the top priority.
Absolutely. Which actually brings up a really important point for you, the listener, to maybe think about.
Right.
Given how quickly some of these emergencies can develop and how critical those first few minutes or hours can be,
Hmm.
what proactive steps could you take, maybe starting today, to feel a bit better prepared for potential skin health scares with your own small animal?
That's a great question. Like,
Well, it could be something simple, like making sure you know exactly where your nearest 24-hour emergency vet clinic is and having their number saved in your phone right now. Or maybe taking some time to learn more about the early warning signs, those subtle changes in skin, or behavior that might signal a problem brewing, something that warrants getting checked out sooner rather than later. Just thinking ahead a little bit.